If stairs feel harder every month, harder every year, and you cannot figure out why, it might not be your legs at all. It might be how you are using the handrail. There is one habit I see constantly in my patients, a habit that feels completely safe and logical, but it quietly trains your body to climb stairs with your arm instead of your legs. And over time, this makes every single step feel heavier than it needs to be. Today, I am going to show you exactly what this habit looks like, give you a quick self-check you can do on your own stairs, and teach you a simple technique that can make climbing feel more controlled almost immediately. Before we go any further, drop a comment with your age and where you are watching from. I love seeing how many different places this reaches, and it helps me understand who is tuning in, so I can keep making content that actually serves you. Here is what I am going to cover in this video. First, I will explain the specific handrail habit that makes stairs harder without you realizing it. Second, I will walk you through a safe rail use self-check you can do today on any staircase you trust. Third, I will teach you the technique I give my patients to replace that habit, something you can feel working right away. And fourth, I am going to give you a short, stair-specific practice plan for the next week, and it is not the same set of balance exercises you have heard 100 times before. This is specifically about retraining how you use the rail, so your legs can do the job they were designed to do. The habit I want to talk about is something I call the arm haul. It is when you grab the handrail and actually pull yourself up the stairs, using your arm and shoulder to haul your body from step to step, instead of letting your legs generate the lift. It feels like you are being careful. It feels like you are using everything available to get up safely. But here is the problem. Your arm is not built to lift your entire body weight up a flight of stairs. Your legs are, and when you start relying on that pulling motion, a few things happen that work against you. First, your torso leans toward the rail. Your center of mass shifts sideways, which means you are no longer stacked over your legs. When your body is leaning, your leg muscles cannot fire efficiently. They are working at an angle instead of pushing straight up, which makes every step take more effort than it should. Second, when you are pulling with your arm, you tend to take short, rushed steps. Your foot lands only partway on the step, maybe just the ball of the foot, or even just the toes. This means you never get the stable platform you need to push off properly. You are always scrambling a little, always feeling like you are chasing the next step instead of owning it. Third, the pulling creates tension in your shoulder, your neck, sometimes even your jaw. You might not notice it in the moment, but that tension affects your breathing. Stair climbing already demands more oxygen, and when your upper body is locked up with effort, you cannot breathe as smoothly. That is when stairs start to feel like you are running out of air, even on a short flight. And here is something that does not get talked about enough. When you rely on that arm haul, your brain learns to wait for the rail. Your nervous system starts to treat the rail as the primary mover, and your legs as the backup. Over weeks and months, your coordination shifts. Your legs become less confident, less automatic. And then, when you encounter stairs without a rail, or you need to carry something up, you feel even more unstable than you did before. Let me give you a picture of what this looks like in real life. Think about carrying a basket of laundry up the stairs. If you have been arm hauling for a while, the moment you cannot grab that rail properly, everything feels wrong. Your legs do not know what to do because they have not been practicing. Or imagine you are climbing stairs while talking to someone. If you are relying on arm strength to get up, adding the effort of speaking can suddenly make you feel winded because your system is already maxed out. I have had patients tell me their arm actually gets tired before their legs do, and they never connected the dots until we looked at their stair technique together. Now, let me walk you through a simple self-check you can do today. This is not a test. This is not diagnostic. It is just an observation tool so you can start noticing what your body is actually doing on stairs. Find a staircase you trust. Make sure the lighting is good so you can see the steps clearly. Make sure the handrail is sturdy and secure. Wear shoes you feel stable in. Start at the bottom and climb just 3 or 4 steps at your normal pace. Here is what I want you to pay attention to. Notice what your hand is doing on the rail. Is it pulling downward and backward to haul your body up? Or is it lightly touching, just guiding and ready to catch you if you wobble? There is no wrong answer here. We are just observing. Now notice your torso. Is your upper body leaning toward the rail, tilting sideways as you climb? Or are you staying relatively upright with your chest tall and your weight over your feet? Again, just notice. Do not try to change anything yet. Here is one more thing to check. Can you say a short sentence out loud while you are climbing without feeling panicky or out of breath? Something simple like, I am walking up the stairs right now. If that feels impossible, if speaking even a few words creates panic, that is worth noting. It might mean your system is working harder than it needs to. If you found yourself pulling hard on that rail, leaning significantly, or feeling breathless after just a few steps, that does not mean anything is wrong with you. It means there is room to improve your technique. And if you rely heavily on that rail right now, you keep using it. This is about refining how you use it, not proving you can go without it. Safety always comes first. Here is what I teach my patients instead of the armhole. I call it the rail glide technique, and it changes how stairs feel almost immediately for most people. The core idea is this. The handrail is for guidance and balance, not for propulsion. Your legs lift you up. The rail is there so you know where you are in space, and it is there to catch you if something goes wrong. But it is not supposed to be pulling you up like a rope on a climbing wall. Here is how to practice it. Place your hand on the rail with a relaxed grip. Your elbow should be soft, not locked. Your shoulder should be down and relaxed, not hiked up toward your ear. Now, instead of gripping and pulling, let your hand glide along the rail as you move. Your hand moves with you. It does not pull you. Now, here is the key part. Let your legs do the actual lifting. When you step up onto a stair, place your entire foot on the step, not just the toes. Push through that foot, through the heel, the arch, the ball, the whole thing. As you push, let your body rise up tall. Your chest lifts, your eyes stay forward, and you stand all the way up onto that leg before you take the next step. Give yourself a cue sequence to remember. Eyes forward, tall chest, steady breath, full foot on the step. Push and rise tall, then glide to the next step and repeat. If you want a simple phrase to keep in your head, use this one. Glide the rail, lift with the leg. That is the whole idea. Your hand glides, your leg lifts. They work together, but they have different jobs. Why does this feel better so quickly? Several reasons. When you stop pulling with your arm, your torso naturally stays more upright. Your weight stays centered over your feet instead of drifting toward the rail. That means your leg muscles can actually do what they are designed to do, which is push you up efficiently. You are not fighting your own body position anymore. When your foot lands fully on the step, you have a stable base. You are not scrambling or slipping or trying to catch up. Each step feels planted and deliberate instead of rushed and uncertain. When your shoulder and neck are not locked up from pulling, you can breathe more easily. Stair climbing still takes effort, but it does not feel like you are suffocating. You can actually get into a rhythm. And here is something my patients report all the time. When they stop rushing because of the armhole, when they slow down just slightly and let their legs work, they actually feel more confident. Not slower in a bad way, slower in a controlled way. Like they own the staircase instead of the staircase owning them. Let me pause here and ask you something. Do your arms get tired on stairs before your legs do? Or is it the other way around? Drop that in the comments because I am genuinely curious. It tells me a lot about what might be worth covering in future videos. Now, let me give you a 7-day practice plan that is specific to this rail technique. This is not a generic exercise routine. This is focused specifically on retraining how you use the handrail and how your legs generate lift on stairs. For the first practice, I want you to work on what I call rail glide step practice. You are going to use just the bottom 2 or 3 steps of a staircase, somewhere with a solid rail and good lighting. Step up slowly, letting your hand glide along the rail instead of pulling. Focus on placing your whole foot on the step and pushing up until you are standing tall. Pause at the top of each step for just a second. Feel what it is like to be upright and balanced. Then step back down and repeat. Start with just 5 or 6 repetitions. This is not about volume. It is about quality. You are teaching your nervous system a new pattern, and that takes attention, not exhaustion. The second practice is controlled step-down work. Coming downstairs is where a lot of people get into trouble, so we are going to address it directly. Using those same bottom steps, practice lowering yourself down with control. Keep your hand gliding on the rail, not gripping for dear life. Lower your foot to the step below. and place the whole foot down, not just the toes. Bend the knee of the leg you are standing on to control the descent. This prevents that jarring thud that happens when you just drop onto the next step. It also prevents those toe catches where your foot does not quite clear the edge. Practice this slowly and deliberately. 5 or 6 repetitions per session is plenty when you are starting out. The third practice is what I call a landing turn reset. If your staircase has a landing where you need to turn, this is crucial. Most people rush through landings, and that is where mishaps happen. When you reach the landing, stop completely. Square your feet so they are both facing the direction you are about to go. Take one breath. Let your eyes lead by looking toward where you are heading next. Then continue. This simple reset takes maybe 2 seconds, but it eliminates the twisted, off-balance, rushing through the turn pattern that causes so many stumbles. Practice this every time you use those stairs. The fourth practice is optional but helpful. It is a step placement target drill. Pick a visual target on the step, maybe a mark in the wood or a spot on the carpet, and practice placing your foot so it lands exactly on that target. This trains accuracy. When you can place your foot precisely where you intend, you stop having those half-on, half-off placements that create instability. Do this for a few repetitions when you are practicing your rail glide steps. For the first few days, keep these practices brief, a few minutes total, not an hour-long workout. You are retraining a habit, and your brain needs time to consolidate the new pattern. After 3 or 4 days, you can start linking things together more smoothly. By the end of the week, see if you can climb a full flight with the rail glide technique feeling more natural. Progression is not about speed. Progression is about smoothness and control. Only after the movement feels controlled and confident should you think about moving a little quicker. Now let me run through some common rail-related errors I see, along with quick corrections. These are all things that work against you on stairs, and most of them are easy to fix once you are aware of them. Pulling yourself up with the rail is the big one, and we have covered that. The fix is gliding instead of hauling. Let the hand move with you rather than dragging you up. Death grip tension is another one. When you squeeze that rail like you are hanging off a cliff, your whole arm locks up, your shoulder rises, your breathing gets shallow. The fix is to keep the grip firm enough to feel secure but relaxed enough that your shoulder stays down and your elbow stays soft. You should be able to feel the rail without strangling it. Leaning your torso toward the rail throws off your center of mass. The fix is to imagine a string pulling you up from the top of your head. Stay tall. Stay centered. Let the rail be beside you, not under you. Rushing the first step is surprisingly common. People approach the stairs and immediately start climbing at top speed before they have even registered where the first step is. The fix is to pause for half a second at the bottom. Look at the first step. Place your foot deliberately, then begin. Stepping with only the toes on the step leaves you with no base to push from. The fix is to place the entire foot, or at least the front 2/3, solidly on the step before you push up. If the steps are shallow and your foot does not fit, angle your foot slightly rather than balancing on your toes. Twisting at the landing while still moving is a recipe for losing your balance. The fix is the landing turn reset I described earlier. Stop, square up, breathe, eyes lead, then go. Carrying items that block your view is another mistake I see constantly. If you cannot see the steps, you cannot place your feet accurately. The fix is to hold items at your side or slightly behind you, not directly in front of your face. Or make a second trip. Your safety is worth more than saving 30 seconds. Using an unstable rail or a cluttered handrail defeats the whole purpose of having a rail. If your handrail wobbles, get it fixed. If it is buried under coats or bags, clear it off. The rail can only help you if it is actually functional. Which brings me to an important question. Which is harder for you, going up or coming down? A lot of people assume going up is the challenge because it requires more physical effort, but coming down is actually where more falls happen. It requires more control, more coordination, more trust in your balance. Let me know in the comments which direction gives you more trouble. If you are finding this helpful, take a moment to hit that like button and subscribe to the channel. When you do, more people who need this information will actually see it, and that is how we keep more seniors independent and safe on their own stairs. I want to add a few important safety notes here. Always practice these techniques near a sturdy rail that you trust. Keep the lighting good so you can see every step clearly. If you feel dizzy, lightheaded, or unsafe at any point, stop immediately. If you need the rail to feel secure, you keep using it. We are improving technique, not proving anything. And please, if you experience any red flag symptoms, seek medical attention right away. I am talking about chest pain, fainting or feeling like you might faint, severe shortness of breath that does not improve when you rest, new weakness on one side of your body, sudden confusion, or a sudden severe headache. Any of those could indicate something that needs urgent care, and stairs can wait until you have been evaluated. Also, if your ability to use stairs has changed quickly, if you could climb fine a month ago and now it is significantly harder, please talk to your doctor or a physical therapist. Rapid changes deserve professional attention. Let us bring this all together. The arm haul habit, grabbing the rail and pulling yourself up the stairs, feels safe, but actually makes climbing harder over time. It shifts your weight, limits your leg power, creates tension that affects your breathing, and teaches your brain to depend on your arm instead of your legs. The alternative is simple. Glide the rail, lift with the leg. Your hand moves along the rail for guidance and security. Your legs do the actual work of lifting your body from step to step. Your torso stays tall. Your breathing stays steady. Your confidence grows. Today, I want you to try that rail use self-check on a staircase you trust. Just 3 or 4 steps. Notice if you are pulling or gliding. Notice if you are leaning or staying upright. Notice if you can speak a sentence or if you feel breathless. Then try the rail glide technique on those same few steps. See what changes. Come back to the comments and tell me what you noticed. Did you catch yourself pulling? Did the glide technique make things feel more controlled? Did your breathing improve? I read these comments, and your experiences help me understand what to focus on next. If you practice this consistently for even a week, using those 4 drills I described, you might be surprised how different stairs feel. Not because your legs suddenly got stronger, but because you stopped working against yourself. You started letting your body do what it was designed to do. Practice the glide. Trust your legs and take every staircase, one deliberate step at a time. I will see you in the next video.